Some of the more common clinical negligence claims, but amongst the most difficult to prove, are claims for delay in diagnosing cancer. In this video, I will explain what you need to prove to establish a right to compensation for negligent delay in diagnosing cancer. I shall explain the compensation claims that can be brought, and I'll look at the options available to you and your family if the person suffering from cancer has a particularly poor prognosis. In any clinical negligence claim, the claimant has to prove that there was negligence by a treating doctor or nurse and that the negligence has caused injury or death. In these kinds of claim, the allegation is not that a doctor or nurse caused cancer, but rather that they failed to take steps that would have led to its earlier diagnosis and treatment. Most often, but not always, these failures are in a primary healthcare setting, i.e. at a GP practice. The patient has been discovered to have cancer at a certain time, say in 2016, but they attended their GP with suspicious signs and symptoms a year earlier. Was the GP negligent in failing to ensure that investigations were carried out in 2015? If so, would the patient have been treated a year earlier? Has the patient suffered injury as a result of that delay? GPs and practice nurses are not cancer specialists. It's rare to allege that they were negligent in failing themselves to diagnose cancer. Instead, the allegation is usually that they failed to refer a patient on for further investigation by a specialist. Very usefully for these kind of claims, there are national guidelines for GP practices to follow. These are produced by NICE, the National Institute for Health and Care Excellence. You can download or view a copy of the guidance online. It's called Suspected Cancer, Recognition and Referral, and the latest version was published in June 2015. The guidance covers the most common cancers. It's evidence-based. It includes certain thresholds for referral, such as an age-specific PSA measurement for referral for suspected prostate cancer, or an age beyond which a woman with a breast lump with certain characteristics should be referred. These are guidelines. They should be followed by GPs and practice nurses, but they do not have the force of law. The practitioner should take into account all the circumstances, including, for example, the patient's family history. A doctor or nurse is not necessarily negligent for not following the guidance, because the test of negligence is whether no responsible body of medical opinion would support the failure to refer. But if they do not follow the guidance, they need to have a good explanation for why they did not do so. Sometimes, rather than alleging that a doctor or nurse was negligent in failing to refer a patient, it will be argued that they should have advised the patient to return in a month or 3 months for further examination or tests. If so, the claimant would have to prove what such examination and tests would have shown had they been done. The guidance recommends referral to be immediate, urgent, or routine. An immediate referral means that the patient should be directed to go straight to hospital without passing go. Urgent means that the patient ought to be seen within the national target of 2 weeks from referral. And routine referrals cover all other referrals. The next thing a claimant will have to prove is what would have happened had they been seen by a specialist when they ought to have been seen. This element of any claim is referred to as causation. But for the negligent failure to refer the patient, what would or should have happened? Let's break that down into 6 stages. What would have been there to find on referral? Would the cancer have been present at the relevant time? What characteristics would it have had? For example, what size would a breast tumour have been at that time? What investigations would have been carried out? For breast cancer, the triple test would or should have been carried out on an urgent referral. That involves examination, mammography or ultrasound, and if indicated, biopsy. Would such investigations have detected the cancer? It isn't automatically the case that reasonable investigations will always detect cancer that is present. Some cancers might not be detectable depending on their stage and size. Upon detection, what further investigations and what treatment would or should have been offered to the patient? What investigations and treatment would the patient have elected to undergo? Remember, doctors advise, but patients choose. What would the outcome of such earlier treatment have been? All of those questions will have to be addressed, and they'll be answered by a combination of evidence from the claimant and others as to their condition and symptoms at the time, about what choices they would have made and so on, together with expert evidence. For example, you might need an oncologist, a surgeon and a radiologist to give their expert opinions. The final piece of the jigsaw, the sixth stage I've referred to, is proving what injury has resulted from the delay. You compare the treatment and outcome as it has been with the treatment and outcome as it would have been on earlier diagnosis. The treatment itself can be the injury. If without delay a woman would have undergone a lumpectomy, but after the delay she had a mastectomy, then she's suffered additional injury by way of more extensive surgery. Perhaps she'll also have reconstructive surgery. Sometimes the delay has caused the need for chemotherapy when none would have been required. The psychiatric effects of the delay must never be overlooked and can be significant. There may be significant financial consequences as well. Additional time off work, the need for care, travel to and from avoidable hospital appointments. All of these are the sorts of financial consequences for which compensation is designed. Finally, there's the question of life expectancy. Has the delay shortened the patient's life? That's an easy question to pose, but a very difficult one to answer. I'm going to mention three key points about proving reduced life expectancy. The courts do not compensate for a reduced life expectancy itself, only for its consequences, such as the financial impact. Whilst doctors talk of the percentage chances of surviving, say, 10 years after diagnosis, that is of limited use to lawyers. We, and the courts, want to know in numbers of years how long a patient will survive and how long they would have survived with earlier treatment. With every day that goes by waiting to see a solicitor or waiting for the end of your case, your prognosis changes. It might change because of a development such as a recurrence. But even if the only change is that you have survived 2 years with no recurrence and no metastases, your prognosis, statistically, will improve. So far as the claim is concerned, the goalposts just keep moving. Claims brought after a patient has died. If someone has died because of cancer and the allegation is that they would have died later, or have still been alive but for a negligent delay in diagnosis and treatment, then their relatives can bring a claim under the Fatal Accidents Act 1976 for the loss of their dependency on the deceased. This is a financial calculation. What would the surviving relatives have depended upon the deceased for had he or she survived? The relatives or the executors of the estate of the deceased can also bring a claim for the suffering and financial losses suffered by the deceased before they died. That's a claim on behalf of the estate of the deceased, and so any compensation would go to the beneficiaries of the estate. Decisions where the claimant is dying. What to do if the claimant is still alive but has a poor prognosis and may soon die? The court might agree to expedite the trial process so that the case is concluded much sooner than would normally be the case. One problem that needs to be addressed is that in these cases is this: if a personal injury claim for the living claimant is settled or concluded at trial, then the whole action is resolved. If that person later dies prematurely because of the negligent delay in diagnosis, their relatives will be barred from bringing a second claim, a claim under the Fatal Accidents Act. So, if you're thinking of settling a claim, be aware that your relatives will be prevented from bringing a claim after your death if you do. In some cases, it has to be said, there would be a larger claim arising from a death than there would be if the case was resolved while the person with cancer was still alive. You have to decide, therefore, whether or not to bring and conclude a claim when you're alive, or should you leave it to your relatives to claim after you die? Well, there are advantages and disadvantages with every choice in these really difficult situations. You might want to establish that there was negligence and what it has caused as soon as possible and whilst you're alive. You might want to have the money in place before you die so that you know your loved ones will have that to help them through. The decisions to be made depend on the circumstances of each case, and you really do need to take legal advice. I hope you've found some of the help you need. Thank you for listening.